Hello, welcome to Learn Anatomy with Dr. Vessel, and today we'll be looking at the part 2 of classification of bones. In part 1, we looked at classification of bone by development and classification of bones by region. Today, we're looking at classification of bone based on the shape of the bone. Now, in classification of bones based on shape, bones can be classified into the following shape. Number 1, we have the long bone. In long bone, the length of the bone is greater than the breadth. The length of the bone is greater than the breadth of the bone. And this bone develops from the cartilage except the clavicle. Now, there's a mnemonic here that can help you remember that the clavicle is not part of long bones that develop from cartilage. And this mnemonic is clavicle is not clever. Clavicle is not clever. The C in clever can help us remember cartilage. So clavicle is not part of the bones, of the long bones that develop from the cartilage. Now the structure of a long bones, we have the epiphysis, the diaphysis, the metaphysis, the epiphyseal plate, and the medullary cavity. The epiphysis is the ends of the bones. The ends of the bones are called the epiphysis. While the diaphysis talks about the shaft of the bone. The shaft of the bones is called the diaphysis. Now with this word ends, you can remember what the epiphysis represents and what the diaphysis represents. Now the ends here, E for E, E for E. Epiphysis represent the ends of a long bone, while diaphysis, the D here, diaphysis, and the S here, shaft. So diaphysis represents the shafts of the long bone. So with this word ends, you can remember that epiphysis represents the ends, while diaphysis represents the shaft. Now the metaphysis is in between the epiphysis and the diaphysis. We have the metaphysis in between the epiphysis and the diaphysis. The metaphysis is the most active part of a bone because it contains a lot of blood vessels. It is highly vascularized, so it is the most active part of a bone because it is highly vascularized. Now the next is epiphyseal plate, which is the growth plate, and the next is medullary cavity, which contains the marrows. Now the next classification of long bone based on shape, we have the short bone. The short bone are cubed shape and they develop from cartilage. An example of these bones are the carpals and the tarsals. Now the next bones we will be discussing the flat bones. The flat bones are thin bones. They are slightly curved and they have two layers of compact bones. Example of the skull and the sternum. Now the next is the irregular bones. Irregular bones are called irregular because they do not fit into the other categories. You can't call them long bones, you can't call them short bones, you can't also call them flat bones. They do not fit into any of those categories, so they are called irregular bone. Example, we have the vertebrae and the hip bone. The next classification is the pneumatic bone. The pneumatic bones are bones that contain air cavities. Example, we have the frontal bones of the ethmoidal bone or the maxillary bone. The next is the sesamoid bones. Sesamoid bones are bones that are embedded in tendons. Sesamoid bones are bones that are embedded in tendons. Example, the patella. Now here's a mnemonic that can help you remember the classification of bones based on shape. And this mnemonic is flips with double S. Flips with double S. F-L-I-P-S-S. Now the first F represents the flat bones. Example, the skull and the sternum. The second F-L represents the long bones. Example, the humerus, the femur, the clavicle, the tibia, the ulna, the radius. The third I represents irregular bones. Example, vertebrae, the hip bones. The next P represents pneumatic bones. Example, ethmoidal bones, frontal bones, maxillary bones. The next S represents short bones. Example, carpals, tarsals. And the next S, the final S represents sesamoid bones. Example, patella and small sesamoid bones of the hand and feet. Now we have come to the end of part 2 of classification of bone. Thank you for watching.